So we have today on Ames on Health, Dr. Duane Taschner. He's a local physician in Southwest Florida, a cardiologist. Dr. Taschner went to University of Florida for his undergrad training. Also went to med school at University of Florida. Did his internal medicine residency at Virginia Commonwealth and cardiology training at St. Louis University. As you know, right now, we're in May 2020, and we're dealing right now with this pandemic with COVID-19. So as a cardiologist, how has this pandemic affected your patients, and has it changed at all how you approach and practice medicine?
Yeah, so as far as our patients, first of all, I'll say that I'm doing only outpatient cardiology now. So a lot of the patients that have really been affected, and we'll talk about the cardiology patients being a group that's very susceptible. Fortunately, a lot of my patients are the ones that I'm seeing in the office have been okay, because we're just seeing them in the office. Some of the ones that actually may have been affected are ending up in the hospital, and I'm not seeing them. So I may see some of them in follow-up in a couple of weeks or a couple of months. I'm not always aware of those patients that end up in there. But what we do know with cardiology patients is they are a susceptible group, and there is felt to be a component of hypercoagulability. So we're seeing that people are having blood clots, whether they may be in the lungs and they have a pulmonary embolism, or blood clots in the heart. So this could cause a heart attack for people that maybe don't have pre-existing coronary disease, or even things like inflammation of the heart or the lining of the heart. So things we call like myocarditis, pericarditis. So I've read different cardiac manifestations to people with or without heart disease, actually. In terms of how it's changed, not only cardiology practice, but I think just medical practices overall. Many of us have been utilizing telehealth, which I think has been great. It's something that was, I think it's needed to be introduced, really scaled up from what we were using before, because why not use the technology that's there, especially for like easier follow-up appointments. So we've done that. And for patients that come in the office, I always felt like we were careful washing our hands and sanitizing, but we've taken that to like the nth degree now, to where between every patient using the wipes that kill everything, including your countertops, and you've got to wear gloves and masks. But I think that's important right now. It's important to maintain the safety of our patients, to maintain our safety, and to make sure that we don't spread this to other patients.
All right, fantastic. Oh, hey Doc, can you I got a phone call, someone coming in. Give me I'm sorry, give me 5 minutes. I'll call you right back. Well,
okay.
I'll let you know when we're back on, all right?
Okay.
Sorry, man, sorry. We're just gonna pick up right where we left off. So I noticed that you stated that you're just outpatient now. I remember I used to see you in the hospital all the time, so that explains it. Why the transition to just that outpatient practice?
Yeah, so we were employed by the hospital for quite some time. My practice was, and some of us decided we wanted to focus a little bit more on the outpatient part. So we always look at kind of the glamorous side of cardiology, the procedures, and those are all done in the hospital. So when people grow up and they want to be a cardiologist, they think, oh, I want to put in stents, or I want to do an ablation procedure. No, it's the procedures that people are drawn to, and they are fun, and they're important. However, even more important is what we do as an outpatient. And most of what we do to keep people healthy from a cardiovascular perspective is by managing their medicines and managing their lifestyle. And I really wanted to focus more on that aspect of it, to prevent them from even getting to the hospital or needing a stent. So when I was going to the hospital, half my time was spent there. And many of the patients, and this well, many of the patients that we see in the hospital are, not necessarily patients that need to be seen by a cardiologist. And we don't really, for many of these patients, we don't make a difference. We're there to comment on maybe a transient cardiovascular condition that's not really going to impact the patient long-term. Whereas here, we're kind of following their long-term, their chronic conditions that we really can influence, and I think have a greater influence on their outcomes.
Nice, yes. Now, along with that, how would you say with the chronic disease and its effect on this current pandemic. How's that being affected by this current pandemic? Can you touch on that a little bit?
Yeah, so it's really interesting. So first of all, I mean, I think one of the scary things about this is it seems like anyone can get it and die. So there have definitely been some young people that seemingly healthy that will die. And I think that's what scares so many people. But still the majority, and the statistic I heard yesterday was about 94% of the people have a chronic condition. And believe it or not, the most common chronic condition was obesity. So that's actually like the greatest risk factor for dying is obesity. And some of the young people I look back that died that I knew from this area, you know, they did have obesity. Maybe they didn't have other chronic conditions. But that was a big one. And coronary disease and diabetes were like the second and third. And guess what? These things they're all related. So obesity begets diabetes. Diabetes and obesity by multiple mechanisms contribute to coronary disease. So this is a susceptible population. And I think that it's, you know, one of the things it's doing is awakening us to realize that, you know what, this is a good opportunity, like one of those aha moments that I do need to make some changes. So even if you're not worried about dying from the heart attack or dying from the complication of the diabetes, the peripheral vascular disease, which I know you deal with, you know, now there's we know that if this is probably not the last pandemic we're going to see or the last infection of its kind that we're going to see. So this is one wake up call for people to start taking better care of themselves to prevent some of these chronic conditions.
Yeah, that's a great point, because I mean, even myself right now, I've become sort of obsessed with the kind of maintaining or getting into a better lifestyle, making some lifestyle changes. And I think we all could take note. I think it all allows us the time to reflect and kind of make these changes that we need to do. And, you know, it's frustrating. I know you're frustrated at times because we have a lot of patients that kind of cross over a lot.
Absolutely.
And, you know, it's frustrating when you're treating these patients when they have these chronic diseases, and a lot of them could be just treated with just some simple lifestyle changes, as you know. So let's touch a little bit on that. I know you're a big proponent of a plant-based diet. How about, can you express why you're such a big fan of the plant-based diet?
Yeah, so I mean, what really turned me on to the plant-based stuff, it was maybe 6 or 7 years ago, where I had been practicing cardiology for 10 or so years at that time. And really, much like you, we see some of the same patients over and over, and we say, well, gosh, you know, people aren't really getting better. They don't feel good. So they still come in, they weigh a few more pounds each year. Their blood pressure may be okay, but we keep going up on their medicines, and same with cholesterol and diabetes. So you kind of have these things under control. You're kind of controlling the symptoms of being unhealthy with medicines,
Right.
but you're really not addressing the root cause, right?
Right.
And what I began to realize was, well, God, I went into medicine to make people better. And am I really doing that? Well, yeah, I guess I'm preventing them from having heart attacks and strokes, or I'm helping to minimize that risk, but there's a much better way to do it. And, you know, the more reading I started doing, I started to watch some documentaries, read books on chronic disease, and it kind of came back to this plant-based diet as really something that can have a major influence on how people can live their lives and whether or not they're going to develop chronic disease, if they can reverse this, if they're going to develop complications. And I've since expanded that to not only just the plant-based diet, but also looking at lifestyle medicine as a whole. So adequate sleep, minimizing stress, anxiety, depression, addressing things like alcohol, tobacco use. But the plant-based diet, in pretty much any kind of population study, and there have been randomized controlled trials, it always shows that, you know, that is the best lifestyle, you know, as far as diet is concerned, in terms of reducing the many chronic things we see, in particular diabetes, cancer, coronary disease, strokes, obesity. So you know, if you look at population studies that follow a plant-based diet, the Adventist Health Study, the Seventh-day Adventist out in California is a big population that's studied. But there are large trials in population trials in Europe, like the EPIC study and the Framingham Heart Study, but they all show the same thing, that the more plant-based foods that you eat, the better you do. The lower the incidence of diabetes, the lower the obesity. And as we progressively add animal protein, whether it's being a pescatarian or an ovo-lacto vegetarian, the more animal protein you add, the worse the outcomes tend to be.
So, so that's a great great segue, I guess, because how do you relate this to your patients? Like, how do you get your? I know sometimes there's a little pushback. Patients
Right?
say, "Well, I can't do this because it's so expensive," or it doesn't taste good, or whatever else excuses that somebody wants to bring to the table about living a healthier lifestyle, much less a plant-based lifestyle. How do you mitigate those arguments or those that pushback that you may get?
Yeah, I mean, you're right. It's a challenge for sure, and especially with the kind of limited time that we have here in the office. But one of the ways I try to motivate people is to let them know that they actually have control as to what's going on. So a lot of patients feel there's like this lack of control. So what I try to do is explore, well, what is their motivation? If they have peripheral disease, do they want to be able to walk better? If they have coronary disease and they had a heart attack, do they want to avoid another heart attack or a stent? Do they want to get on a lower dose of a statin because they don't feel great on the statin? So we try to find these motivating factors, and then I bring up, studies. So my blood pressure's high. I don't want to be on all these medicines. What can I do? Well, here are some studies that support that these foods can drop your blood pressure by 10 or 20 points. I actually have a whole sheet of lifestyle changes, which shows like the average drop in blood pressure with each thing: resistance exercise, cardiovascular exercise, better sleep, eating plant-based foods. So a lot of it is trying to find what motivates them, and then trying to introduce them to some of the concepts. Now, the problem is this is not an overnight thing. This is something that what I really try to do is say, listen, any major lifestyle change is overwhelming if you're starting at 0 and you've got to go to 100. So let's not think that way. Let's try to make some achievable changes that we can do now, and in a few weeks or 3 weeks or a month. If you're successful with those, maybe we make a couple more changes. And the problem we have in how the American medical system is run is we just don't see people. We can't see people that frequently, and just seeing someone for nutrition is not well reimbursed, right? I mean, that's not what doctors get paid for here, unfortunately.
Right.
But that's kind of how I try to approach it, and we'll probably talk about the lifestyle center a little bit more. But this was kind of the whole reason that I said, well, maybe I need to develop my own way to get this message to patients, that we can have them be accountable every week, and we can be motivating and really stay on top of them until they are able to enact a lifestyle change, which is hard. I mean, habitual habits are very hard to change.
Yes, sir. Yes, sir. And then you gave me a great lead into the next question, which is your new endeavor, Vibrant Beats. I like the name. I like the logo.
Oh, thank you. Thanks. I had a card here, but I think I just gave my last one out.
That's great. That's great. So can you explain a little bit the concept and what prompted you to go in this direction?
Yeah, absolutely. So yeah, Vibrant Bee kind of came about 2 years ago. It was actually 2 years ago in April when I said, well, I'm going to try to start an online forum, because again, it's hard to convey all the information we need to convey to patients in the office. So I said, you know what, I'm going to start posting like just articles and blogs about blood pressure and nutrition and cholesterol nutrition and whatever's kind of a hot topic in nutrition and cardiovascular disease or health. I have some on cancer, and I have tons of recipes, plant-based recipes. So when they say, well, what like you said, what tastes good, or what can I make with it? It's just going to be salads. I can direct them to my website, and I have a bunch of recipes that I've made and photographed and put on there. So it started out as this forum, and I really wanted to take that to the next step and really be able to stay with the patient, work with the patient until they're able to make a meaningful change. And in order to do that, you really need to see someone every 1 to 2 weeks. And like I said, make these small changes week to week. So, where we can sit down with them and say, these are some of the things I think will improve your lifestyle. And maybe let's pick 1 or 2 of those things that are achievable. And some of them are as simple as hey, this week, let's try to add a cup of greens 3 days. If we can do that 3 days a week, and let's try to get out and walk, for 10 minutes, 3 days this week. Okay. That's better than what you're doing now. And you know what, when they come back a week later and they said, I did 15 minutes, 5 days a week. That's awesome. You like exceeded your goal. And I got greens in every day. Awesome. So you achieve that, and they've had some success, and then we can build on that and make some more achievable goals. So it's really about, that's the kind of thing that we can't do in the office.
Right.
And I can tell people, go ahead and do this exercise, walk for 50 minutes, walk for 30 minutes, do some resistance training. So the Vibrant Meat Lifestyle Center has nutrition counseling that we want to see the patients every week. We have a gym. So we have an 800 square foot gym with a lot of functional fitness equipment. We have trainers there. So we can say, listen, we're going to walk you right down the hall to meet with one of our trainers, and they're going to work with you to devise a personal program. And you can come in here 2 or 3 times a week. We can teach you some things to do at home. And then we also have a kitchen. We have a demo kitchen. So we're going to do lectures in there. We're going to do cooking classes in there, because all these things that we can't do in the office because the time doesn't allow for it, we have it all under one roof. They can learn to cook these healthy meals. They can come in with their family and they can come in with their friends and learn how to cook healthy meals. And we're going to sell some healthier foods. So all of this stuff that we can do for lifestyle change that we know can really influence the root cause of these chronic diseases is going to be under one roof. And that's really what I wanted.
Yeah, that's impressive. I mean, that's a great way to approach it, a holistic approach, taking the whole body. And trying to welcome the patients. It's hard because you want to treat patients, you want to get them better. A lot of times they just, like you had mentioned earlier, it's the symptoms. You're just trying to take care of the symptoms, or the patient wants those symptoms gone, but we're not getting to the root cause of the problem. And I like what you're doing there. So, on a tangent, how do you feel? What do you feel about? How do you feel about the meat substitutes, the Beyond Meats, or the other products like that? Do you find those are beneficial? Or those are good? Is it good to substitute the fake meat, so to say, for regular meat?
Right. Yeah. So I think when you look at, so that's a good question. So if you're going from a regular meat that may be high in saturated fat, like a red meat or bacon or something like that, and you move to maybe a soy-based or pea protein-based processed meat, there probably is some benefit in terms of you're reducing saturated fat, you're probably increasing your fiber a little bit. That being said, I mean, I look at these still as ideally as like transition foods. When we talk about a whole foods plant-based diet, the kind of foods that have really been shown to influence health, it's really about eating foods in their most natural forms. So for people that say, listen, I'm just used to eating burgers and chicken all the time and chicken nuggets. Well, before we go right to just eating beans and learning how to prepare them and making your own veggie burgers, let's try to if you feel more comfortable adding in some of these products that are plant-based, that are more used to what you're eating, what you're more familiar with, that's fine. Let's include those with some of the other whole foods. It makes the transition easier. Long-term, our goal is to try to even phase those out and really try to stick to whole foods. So when I talk to people, I try to focus on like your veggies, like your leafy greens and your cruciferous vegetables, your beans, nuts and seeds, whole grains, and fruits. Those are kind of the pillars that I really try to focus on. And it doesn't mean you can't ever have those other things. I eat a Beyond Burger or an Impossible Burger like I used to eat a burger. Like, I don't look at it as a health food. But I say, if I was going to go out to a barbecue and have a burger, have a Beyond Burger. I still eat pizza. Like, sometimes I get it with no cheese. Sometimes I get it with vegan cheese. Is that healthy? No, it's probably better than regular, dairy cheese, but it's not a health food. And I try to make sure people understand any of these processed foods still can have adverse consequences if eaten in excess. And so they really should be foods, like you should treat them just like you treat those kinds of foods now.
Right. See, this is a great topic, because I could really deep dive into this right now. I'm trying hard not to extend
You're
this
welcome
to a 2-hour talk, because I find it fascinating, the nutrition aspect of it, and I think that's underutilized. Even in my practice, I try to make little tidbits on certain supplementation and things that you can do to help out. But
right.
Just so we don't go too much into the deep end and get too geek out on this stuff right now. What about, how would you recommend to patients that are that want to kind of boost their immune system during this time? what foods would you recommend that they intake, or even supplements that they will intake during this time?
Okay, yeah, it's a good question too. And one of the things I would just hint on too, going back to that last question is, one of the things that I really do like to do without taking too deep a dive is try to create familiar recipes. So like, using like lentils or tempeh as taco meat, or meat and pasta sauce, like things that maybe take a step back and you realize that maybe you don't need to have those processed things and still make something that's awesome.
Right.
I made a really good mac and cheese the other day, but it had no cheese in it. It was like, it was all made out of vegetable products. And I promise you, like, you couldn't tell the difference.
No,
So
that's great.
that's part of it, is like showing people like what you can create with whole foods right in your kitchen, that it's just not that hard. And that's why we want to have the demo kitchen there.
Right.
So going to this question with the immunity. So one of these interesting facts that I've learned recently, and there's a great gastroenterologist, he's actually has a book coming out in a couple of days, but he talks, Dr. Will Bolsowitz is his name. Very hard to spell. They call him Dr. B, but he's out of South Carolina. He's just a huge plant-based advocate and really has done a lot of research on the microbiome. And, one of his points that I've heard him make over and over again is that 90% of our immune system is in our gut.
Yes.
And if you don't keep your gut healthy, your immune system is not going to be healthy. And guess what? Most people here don't have a healthy gut. Most people in our country. So if you look at a Western diet, it tends to be a very low fiber diet. And on average, we as Americans consume 18 grams of fiber a day. And the recommendations are more in the range of around 40 grams that we should be consuming. But ideally, it should be even higher than that. It should be 50 to 75 grams a day. What is good to help your gut bacteria grow? High fiber foods, things like beans, legumes, all of these things I just mentioned, the cruciferous vegetable, leafy green vegetables, whole grains. So we don't digest some of these things. Like there is insoluble fiber in beans. There's resistant starch. These are things that we don't digest, but our gut bacteria digest them. And that causes our good gut bacteria to flourish. And then, what you don't digest, you actually kind of, you poop out. So what the great thing about some of these foods is that you could eat 200 calories of beans and you only absorb like 150 calories of them. But that's a really important thing, is keeping the gut healthy. And that also helps prevent what they call leaky gut. So if you have a lot of inflammation in the gut, the barrier of the gut that prevents the toxins from getting into your blood and causing like inflammation, autoimmune disease, that a lot of people have this leaky gut. So if we keep the gut healthy, these junctions are much tighter and we keep that barrier intact. So that's one, thing that I really stress to patients. We're going to talk anything about immunity. There are compounds of many different foods, though. If you read about plant-based foods and immunity, what I tell people is to try to eat the rainbow. So the more colors you're going to eat, each of these different colors is a compound, a polyphenol, basically something that gives the plants their colors, but those are like antioxidants and nutrients. And the different colors are different phytochemicals in there. And there are different phytochemicals in many of these plant-based foods, which have been found to boost immunity in different ways. But again, without taking too deep a dive, that's probably the easiest way, is to say, try to get a diversity, eat things of different color. And I really try to do that. I'm a huge believer of that. And as you do that, you're going to boost your immunity by different ways, just like using different blood pressure pills, right? They all have different mechanisms. And if you hit the blood pressure, you attack different targets, you're going to be more successful than just using a high dose of one blood pressure medicine. Same thing, same concept here.
Right. Great points. I love the microbiome. I think the microbiome is fascinating. And the gut is, another thing that we really didn't learn, during our, schooling. And
Not at all.
Yeah, learning about it now is amazing how much that plays a role. Just not even just in our immunity, our immune function, but also in our, neurological, our mood.
Yep.
Was it 90% of our serotonin is located or formed of the gut?
Yep.
Which is amazing. So when you have that feeling in your gut, there's some truth to that, right?
Absolutely. It's funny that you brought that up, because I was just going to say that. So 90% of our serotonin and dopamine are made there. So there's a very high incidence of depression, anxiety, and people that have this leaky gut, this poor gut microbiome. because they're not making enough serotonin and dopamine. Those are the happy hormones.
Right. So so once again, so now what I would like to do is we're gonna go a little bit off topic. So that kind of we kind of touched on the meat and potatoes of it right now. So usually what I like to do after, we get the meat and potatoes and we kind of, geek out a little bit. I like to show that, that we're human, or that you're human, or, our physicians are human. And I just ask a series of questions.
Okay.
You can't back out of it. You can't give a politics.
I love it.
Answer. You gotta give me the real deal. All right.
Straight up. Yep.
Straight up. Okay. All right. So no chaser. So all right. Number one is, what is your go-to comfort food?
God, I'll tell you. I can't say that I've had one, but after this mac and cheese I made the other day, that was darn good. As far as, that's like a classic American comfort food, and this one was awesome. So right. I'm gonna go with that because it made me feel very good.
Mac and cheese. All right, that sounds good. So so during this quarantine time, would you rather watch a good show on Netflix or any other Hulu or whatever streaming app that you use, or would you rather read a good book?
Wow. I have to say I've been taking advantage of both, but I'm probably watching, I have to say I'm probably watching the shows a little bit more. And one of the reasons is I'm doing so many other things that's requiring reading right now with getting the business going and for work, that I feel like I need to be a little bit mindless and, yes. Let my brain relax a little bit. So I would say I'm taking more advantage of watching some mindless shows that are entertaining.
All right. So in relation to mindless shows, what is your binge show right now? What is your favorite show to binge?
Okay, so now hopefully no one will judge me on this, but I did finish watching Ozark, which I love, and that the one that I've been binging on, I am way behind the curve because I just started watching Below Deck, and my son was watching it, and I was like, that's pretty entertaining, and so I'm like, I've never watched it before. I think I'm on with the most recent season that there's probably 20 episodes, and I've just been watching like every night. I'm watching it for like an hour. It is super entertaining, and in a way, I think it's comforting in a way too, because I love to travel. Right. I love to travel, and we're actually supposed to go to Asia this summer, so we weren't able to do that now. But the current episode is taking place in Thailand, so it makes me feel some sense of comfort too, that I'm living vicariously through these people sailing through Thailand.
Right.
But yeah, that's been my binge show.
All right, your binge show, Below Deck, right? All right. So next one, weights or cardio?
I'm a combination person.
No. You gotta choose, man. There's no combo. I didn't say weights or cardio or weight. I said weights or cardio.
I gotta choose one or the other.
This is my deep journalistic, attempt right now. I gotta give the hard hitting questions.
I got you. So most of my workouts when I do them day to day, I try to do like light weights in a high intensity format, so I kind of keep my heart beating. But if I were to choose one, I would choose weights. And I think for me, I enjoy it more. I also think that the resistance training is good to boost your basal metabolic rate. I think they've proven that. It's good for your bone strength. And I just feel better. I'm a thin guy to begin with. So doing too much cardio, I feel like I just kind of get emaciated. I like doing the weights, body weight stuff, resistance training.
All right. There you go. See, that wasn't that hard, right?
you drug it out of me.
So, all right. And then, speaking of working out, what's your go-to music, or your go-to music during your workouts? What do you? I've
got some crazy stuff on my. I have it on my iTunes. So I have everything from like teeny pop songs that I like that make you want to dance to some old stuff from like Queen, like Fat Bottom Girl. I like a lot of kinds of music, but most of what's on there is like your kind of teeny pop stuff that makes you feel like you want to dance, like.
All right.
Yeah. Lady Gaga, stuff like that.
Lady Gaga. All right.
She's on there. Again.
Yeah, we're not gonna judge you. We're not gonna judge you on it.
Don't judge.
There's no judgment zone here. All right. And then one last question. So if one of your children said that they wanted to go to Florida State,
Oh,
what would you say, and what would you do?
well, I tell them first, you're lucky we prepay for your college, so I can't threaten that I'm not going to pay for it. But well, I will tell you this: my older son is going to college next year, and I didn't restrict him from applying anywhere, but he did not apply to Florida State. And that I was like, man, you should probably apply because Florida is really hard to get into right now. Yeah, unfortunately, or I mean, I guess fortunately, my kids were raised as they're such gators. They bleed orange and blue like us. And it's funny because my younger son, I can guarantee you won't apply there. He is a huge Florida fan. Ultimately though, Florida State is it's a school that continues to climb in terms of the public rankings. And I think there's so many good students in Florida. And
You're giving me a politician answer. Come on, man.
But no, I would
them. They
prefer
can
that
write them out the will, whatever it is. You can say it. It's all right. I'll probably edit it out anyway.
Yeah, I won't talk to them again. Okay, that's it. No, I love my kids, but yeah, I would definitely have some angst. I would suffer if they were going to Florida State. We would have to have some words.
There you go. That's all right. Keep it real. All right, so that's great. So, like I said earlier, we have a lot of patients that we have a lot of similar patients, that see both of us, and we know we both deal a lot with chronic disease. So I wanted to have you on. It was that they're probably thinking why cardiology and podiatry, how does that come together? But like I said, we see a lot of similar patients and we deal a lot with the similar problems. And I just want to get your insight and your input on how you're handling it during this time, and give some recommendations maybe to our patients that may be watching and kind of considering trying to change their lifestyle, whether it's due to having peripheral vascular disease, coronary artery disease, or diabetes. So a lot of these things are kind of go hand in hand. So anything that you like to add to discuss at the end, any recommendations on patients, what they can do, or how they can get in contact with you and make these changes to their lifestyle?
Absolutely. So you hit the nail on the head, man. It's like, sometimes people think, well, the heart's up here and the foot's all the way down there, and how are these things related? And why do these guys see overlap? Well, most of these chronic diseases, relate to poor lifestyle, and among those are diabetes and vascular disease, which those two happen to be related. And I tell people, like, the vascular system runs throughout your body. So if you have coronary disease, you probably have some plaque buildup in your legs, and vice versa. The patients that you see that have bad peripheral vascular disease and maybe have to have a foot amputated, they have a non-healing ulcer. Most of those people die from coronary disease. They don't die from the foot amputation, or they have a stroke. Right. So these things are all related. I think for people that are, the way that I really like to get people motivated is to tell them that they have the power to fix this stuff. So they didn't get, most of these people didn't get these vascular problems from genetics. Genetics is one risk factor, and they've actually showed that we can influence which genes are turned on and turned off with lifestyle. So I tell them, like, don't be convinced that your genes are your destiny. Like, you can influence them. So I think that's a really important point. And so many of these patients, I feel like over the years, just by how we treat them, really feel like this lack of control. And if you give that control to them and you say, listen, these are the tools that you can make yourself better, then those that are motivated to do it can do it. And a lot of it's just about finding that motivation. What's going to get them excited about it? If you look at Dr. Esselstyn, he has a book on how to reverse cardiovascular disease. And I mention this because this affects both of our patients, but he had this initial group, which was about 20 patients, and put them on this very strict, and these were like the worst of the worst. So these vascular people that had no options left for medicines or intervention, cardiac patients, same thing, no options left, refractory angina, peripheral vascular disease, they couldn't walk. And he put them all on this very strict vegan diet. And these people did amazing. Like, many of them are still doing amazing 20 years later. and means that they could walk without pain in their chest, walk without pain in their legs. So like, if you tell your patients like, hey, this is a real thing. Like you could, if you're having so much pain now, we can only do so much with stents and medicines, but you can really improve your quality of life by changing your lifestyle, by changing how you eat, and all we have to do is start making some simple changes. And I'm not asking you to become vegan. I don't even like using that word. Actually, I just say, listen, let's try to introduce more of these kinds of foods and try to have you eat less of these kind of foods. And I have handouts in green, red, and yellow lights, so different ways to convey this information to people. But there's tons of books out there. I try to put a lot of stuff on my website, which the website is, I have two of them. One of them is vibrantbeat.com, and the other one is vibrantbeatlifestylecenter.com, which kind of tells what we offer, at the Lifestyle Center. But if you look at the vibrantbeat.com, we've got tons of articles and references and recipes on there. So for people wanting to make me take that next step, that's a great place to start. My contact info is on, they could actually reach me directly through the Vibrant Beat Lifestyle Medicine website. There's a patient inquiry page where an email will come directly to me, or they could send info@vibrantbeat.com. That's another way that if anyone wants to reach me, that's another easy way to do it.
All right. Well, I'd like to thank you, Dr. Taschner, for taking out the time.
Yeah, this was awesome.
Schedule, yeah, and hopefully, we can, if you have anything, any events or anything coming up, I like to take part of that, the cooking classes that you have lined up in the demo. That'd be definitely a good. I would love to do that. But
we'll make some mac and cheese, man. It was so good.
All right, yeah, we could do that. I like bacon on my mac and cheese, though.
I can do that too.
All right, so we appreciate you taking out the time, and once again, I appreciate what you're doing in the community.
Well, thanks, man. Thanks for having me on.
Ain't no problem.
Awesome.
So for Aims on Health, this is Dr. Cumberbatch with Dr. Taschner, signing off. Have a great day.